In this video, I'll quickly talk about blood loss during delivery. Pregnancy is a journey and it's going to be a day of delivery. On the day of delivery, everyone going through delivery is going to lose some level of blood. There's going to be some loss of blood. However, the amount you lose during delivery is very important. Sometimes can even determine between life and death. And oftentimes it is when people are close to delivery, they want to prepare. They'll tell you, oh, what do I do to prepare for delivery? What can I do now? What are we doing next 1 week? Are we doing the next 2 weeks? How do I prepare for the delivery room? It's important to know that once you're confirmed pregnant, you're supposed to start preparing for your delivery from that moment. And when it comes to blood loss during delivery, it actually starts from your pregnancy journey, not few days or few weeks to delivery. When it comes to the amount of blood a woman is going to lose during delivery, there are so many things that can contribute to it. However, there's one aspect that is so important, that if you're pregnant, you need to start paying attention to that right now. You know your blood level, how you build your blood level is going to determine how much blood you're going to lose on your day of delivery. And this is what I mean. When a woman puts to bed, nature is so wonderful. God is so wonderful that everything is not just in the hand of your caregiver. There's a role your caregiver is going to play. There's also a role you're going to play as a pregnant woman. And these roles are actually many, but there's one very important one not often talked about, which is your blood level. When it comes to blood level in pregnancy, it is so important. It's going to determine a lot of things. Your blood level is going to determine how much blood you're going to lose on the day of delivery. If your blood is low, it can make you have difficulty with breastfeeding. If your blood level is low, after delivery, recovery can also be very slow. So when it comes to building your blood level, it is so important. A blood level can determine how much blood you are going to lose on your day of delivery. And this is what I mean. The baby has been delivered, the placenta has been delivered. It's not just about you giving medications or doctors doing their thing. Your uterus, that's your womb, has a major part in controlling the amount of blood you are going to lose. A normal uterus that has enough blood supply contracts better compared to someone whose blood level is low. When it comes to low blood level, it can so affect the womb in a way that a uterus is supposed to contract, because during the point of delivery, after you've put to bed, your uterus is supposed to contract. And that contraction is so important because that is what is going to help those uterine vessels to stop bleeding. If the uterus does not contract well, that woman is at risk of bleeding. And oftentimes, women with low blood level tend to have weaker contractions when it comes to their uterus trying to control bleeding. So you now have instances where a woman has put to bed and this uterus is weak because the blood supply to the womb is not so much. So women who have low blood level tend to have weaker contractions after delivery and they're at risk of bleeding. And that bleeding is even worse because the blood is not even much in the first place. It's double jeopardy for that woman. So if you're a pregnant woman, ensure you build your blood level. It is so important. For those who have gotten our book on how to eat in pregnancy, you will understand what I'm trying to talk about. Your nutrition, your prenatal vitamins, your regular checks, your PCV, your blood level. These things are so important. You pay attention to them during your pregnancy journey. So it's not, oh, delivery is in few days, delivery is in a week's time, delivery is in 2 weeks' time, or I'll be doing 1 month's time, or I'll be doing 2 weeks' time. You start running health scatter. The moment you discover you're pregnant, you start paying attention to your blood level. It's going to determine a lot of things. Like we usually say, blood is life. Indeed, blood is life. And if you're pregnant in all your preparations, pay attention to your blood level. I hope this is helpful and I hope to see you in the next video. Until then, bye.